Hi guys, welcome to my YouTube channel. This is Mediatrick, and if you're new here, this is a mental health platform where we talk about mental health issues, learn how to deal with the mental health issues, learn how to cope with them, just get knowledge of what basically we are going through as human beings psychologically mostly. If you've not subscribed, ensure you hit that notification button, share out to as many as possible, help me reach out to people who need this knowledge, your friends, your colleagues, your siblings, your parents. We are going through mental health issues, and it's not good if you're going just to assume about the issues that we are going through. So help me reach out to many as possible. Subscribe, share, comment. Don't feel shy to ask questions. Come on, ask your question and I'll be willing and ready to respond. So today we are talking about depression. And the other week, we talked about stress and stress management. And therefore I just thought it is proper if we talked about. So let's go to our video. So today we're talking about depression and its management, how we're going to cope, how to identify things that we can look at, and things that can really increase our chances of having depression. So stay tuned, don't go away. So depression, that's a common word most of us might have interacted with, but somebody's undergoing depression. But do we take a moment and get to just know what is depression? What is this person going through? So depression is used to describe a range of moods, from low spirits to a severe physical problem that affects the way you feel about yourself, other people, and the things in life, and even your day-to-day activities, And the key point there is from low spirits to a severe physical problem that affects the way you feel about yourself, the way you feel about the people around you, the way you feel about other things in life, and even your day-to-day activities. And something to note, that anybody can be depressed. Depression doesn't choose age, doesn't choose gender, doesn't choose color. It doesn't choose who you are. It doesn't choose the rich, poor, Anybody can undergo a depressive moment. So let's check what are the chances that can increase depression in us. Number one, I'll talk about family history of depression. Most people may not know it, but when you're coming to do a psychiatric, when I'm taking a psychiatric or a psychological assessment, a common question we psychologists are going to ask is there anybody in your family that is going through this that you're experiencing? Maybe now let's deal with depression. Is there anybody who has had depression in your family? Because that can also increase your chances of really having depression. So family history check. Do you have that in your family? Is it like a cycle? Somebody had depression, then the other person got depression, the other person was diagnosed with depression. Your aunt, your father, your grandparents, your siblings, your sister, your uncles, check your close and extended family. It's very important to get that history in your family. Number two is childhood traumatic experiences. These are things we really ignore in most parts. Parents, it is very important you talk to your kids. It's also important for children to go through counseling. That's because there are things we kids we go through, we just keep them, and at one time it's going to blow out of proportion. What will we do at that point? These are things that are piled up in a child's life that one day will explode and lead to a depression situation or a depression illness. It's very important for kids to go also for counseling. As I've said, depression doesn't choose age. A kid of 10 years can be diagnosed with depression. That's because of the traumatic experiences this kid goes through. That's because they don't have somebody to talk to. If you're a parent, you're too strict or too harsh to the point that this kid cannot open up what they feel inside of them. We'll go to the management. Number 3, chance of depression increases with age. There is also an age that depression can really be rampant. And when I talk about age, I am basing on mostly the youth. When we're trying to grow up, adulting, as we say, it's a scam and everything. There's so many things you want to achieve. There's so many things we want to get. There's so many things we want to get them right. But at the same point, we don't stop and think about our mental health because, realistic goals, then you don't achieve them. When you set unrealistic goals, they become like a stress to ourselves. We push ourselves so much. So when it comes to age, I would mainly base on the youth because this is a time when you want to achieve so much, you want to get so much. There's a lot in your life that is going on. There's a lot that you don't understand. And at some point you feel like you can't talk to anybody. You're so much in that cocoon. It's eating you up. But now the ability to share out with someone is limited. The next one, prolonged illness. When I talk about prolonged illnesses, I'm talking about illnesses that can be cured and you've not made peace with. Illnesses like HIV and AIDS. It's a condition that you have to live with for the rest of your life. But then if you've not really embraced yourself, forgiven yourself, and you stopped blaming yourself, you will continue having stress. And when it becomes prolonged, it will lead to depression. A disability, that you maybe have, it can cause depression because of continued stress about that disability. Continue to think about how it's affecting you, how it's maybe bringing you down, bringing your self-esteem, your ego as a person. That can really, really increase the chances of getting depression. And the last one, obviously, is prolonged stress. It increases the chances of getting depression because once the stresses have been prolonged and then the stresses have been too many to deal with, then obviously depression will come knocking on your door. So what causes depression? Let's now look it in a medical term. The brain has certain chemicals known as neurotransmitters that work to keep your mood balanced. When your brain doesn't have enough of these chemicals, you become depressed. I hope we now understand. When the brain does not have enough neurotransmitters, then you will become depressed because now these neurotransmitters balances the mood. They don't make us to be extremely happy or extremely sad. There is a balance. So if they lack and if they're insufficient, then depression is there for us to deal with. So how do you know you are depressed? These are things that you can look at. And the signs that I'm gonna give, you're gonna check. If you have 5 or more symptoms for at least 2 weeks or longer period, then please just go and see a psychiatrist right away so that they can help you deal with it. Number 1 is not sleeping, commonly known as insomnia, lack of sleep completely, or you sleep too much. Let's not assume sleeping too much. You can't control it. That is number 1 symptom of depression. Number 2, restlessness. restlessness. You are not settled at all. You are like having so much to do. You're not restless. You're not settled in any form. That is a symptom of depression. Or you're too slow, you're too slow. And this is a sign, that a symptom that people are the ones who are going to observe it. You're too slow in your doing things. You're too slow in walking. You're too slow in everything. You're just too sluggish. That is a symptom of depression. Number 3, you can't make decisions or you can't concentrate at all. Lack of concentration. That means your mind is racing. Your mind is at work. Your mind is busy on a lot of things. So when you are having that lack of concentration, therefore that means you are undergoing depression. The next one is feeling low throughout the day. When I'm saying feeling low throughout the day, I'm meaning feeling low the whole day. This is another symptom that, hey, depression is knocking. Depression is knocking. The other one is blaming yourself too much. Self-blame, guilt. Those are 2 signs that you are having a stressor and depression is on you now. Guilt and self-blame. Or feeling that worthless, you feel like, I'm useless, there's nothing I can do good. I'm just not there. Feeling so worthless about yourself. You don't even appreciate yourself. You do things, people are like appreciating. Oh, maybe what you've done is really good. But for you, you're like, not really. I've not really done it. Because, you feel worthless. You don't feel like there's something good that can come out of you. That is depression. It's a symptom of depression. The next one is fatigue or loss of energy nearly every day. We understand sometimes you might go to work and then you come back and you're feeling so tired. You're feeling like, you low on energy, but it should not be every day. If it is every day, then it is good you get the right help. There can be either burnout that you're experiencing, a stressor at work, or maybe parenting, fatigue, stressor, or maybe if you're a student, exams are really running short on you, on your neck every time. They're really taking a toll on your life. Then that means there is a stressor, which when prolonged causes depression. The next one is significant change in weight. That will show either you're eating too much. Okay, I think I will now add the 2. Significant change in weight or appetite. Because if you have loss of appetite, therefore that means you're not going to eat so much. So if you're not going to eat so much, you're going to really lose a lot of weight. Then if you eat too much, that is overeating, which is also another way people deal with stress, and then it becomes like a habit that you've now, like a coping mechanism you've employed within yourself. Therefore, that shows that you're going to really gain a lot of weight within that period of time. So significant change in weight or appetite, either gaining too much weight or losing too much weight, losing appetite or having a lot of it. Overeating too much is not good. So that is another symptom to check out for. Another one is thinking about death frequently. Suicidal thoughts. This is actually a red flag when it comes to depression. When someone has suicidal thoughts, it is important that this person gets help immediately, because suicidal thoughts can lead to, actually they manifest faster than any other thing. When a person is in depression and you have a friend who has, and you've had them say, I feel like this life is no more, nimefika mwisho. That is what we always say. I'm there. I'm at that age where I'm on that fence where I can't push anymore. I've been pushed to the wall. And at this point, I feel like nothing is working out, nothing is going on right. So I have felt like the best I can do is to take my life. Please, 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 if you get such kind of a comment from any of your friends, it is important you get them help from a therapist, a psychiatrist, a psychologist. Just get them help as soon as possible. The next one we'll talk about is when you have loss of interest in favorite activities, the things you used to enjoy. Now, all of a sudden, you don't feel like, when you loved traveling, you loved adventure, you loved spending time with family, and now all of a sudden you feel withdrawn. You've isolated yourself. That is a symptom that you are going through depression, and it is important you get treatment. And without treatment for these symptoms, they can last for months, they can last for years, they can last for weeks. But it is important to go and get treatment whenever you see or experience any of these symptoms. You can also at home just sit down and take a book, listen to the symptoms that I've listed. Are you undergoing any? Is there any that you are undergoing? Don't let them reach to 5. Let's start dealing with them one by one. So now that we've gone through the symptoms, so let's check, how do you overcome the symptoms of depression? Number 1, obviously, we'll talk about antidepressants. A point to note, you don't diagnose yourself with depression. You don't prescribe yourself depression drugs. You need to go to a psychiatrist, a psychologist, a counselor. Let them deal with it, because we have some symptoms that you don't need medication. You just need therapy and everything is going to be okay. So number 1 way is drug treatment. And when I talk about drug treatment, I'm talking about antidepressants. And antidepressants act by increasing the activity of those brain chemicals which affect the way we feel. So they stabilize our mood. They help to produce more neurotransmitters in the brain, which will help in mood balancing. Well, point to note, you don't take antidepressants for a whole year, you only take them according to the prescription that you have been given. So it is according to the psychiatrists that is going to prescribe how long. They can be taken for at least 6 months or longer, depending on the age and also the intensity or the gravity or the impact that depression has had on you. And something that you should expect, it's like a common thing that happens when you've been prescribed antidepressants, and you've taken them well. So after you're in recovery now, maybe you've stopped taking the antidepressants, you're more likely to relapse after 3 months after you've started recovering if you are exposed to a depressive episode. But not to worry, doesn't happen in everybody, but it happens mostly after you're in recovery of depression and then you are exposed to a trigger. I will call it a trigger. There's a chance that you can relapse and go back to depression again. So the next one, I'll talk about counseling. It's an non-drug treatment. Number 1, I'll talk about counseling. Counseling is a therapeutic intervention. It helps in solving problems and provide new ways to cope with difficulties. It is during counseling where we teach you coping mechanisms that can help you deal with certain situations. Number 2 is called cognitive behavior therapy, commonly known as CBT. CBT is a process of individual assessment of your belief and self-concept using question and exercise to help see the situation in different ways and to build coping skills. But CBT is a technique used in counseling. Number 2, non-drug treatment. Number 3, interpersonal therapy. Interpersonal therapy focuses on your relationships and problems such as difficulty in communication or coping with bereavement. Bereavement comes in when someone has undergone loss. So me as a counselor or as a therapist or as a psychologist, I am going to use interpersonal therapy to help you focus on your relationships and problems such as difficulty in communication, I'm building you as a person, to be more self-aware, to be more mindful of your environment, to be more mindful about yourself. Therefore, it's easier when you're mindful to watch out. When a point reaches, you're like, no, I don't want to go to that drain, The next one is called electroconvulsive therapy, ECT. ECT is always chosen as the last resort, only in the cases of emergency in severe depression. Patients are given shock treatment to the brain through electrode. I don't know if most of us have understood, but anyway, not to worry so much. That's not according to you, but I'm just giving you information so that you can know which ways we use to treat depression. But it's always something when now the drug treatment has failed. We've gone to counseling, it has failed. We've done the therapies, it has failed. Now we do the electroconvulsive therapy. That is, we give a shock to the brain. There's a way we do it to the brain so that the brain can now remove or produce more transmitters to help you balance the mood and deal with the depression. So let me talk a little bit about the antidepressants. Antidepressants medication is not active or a habit-forming medication. They are not your uppers, feeling high or you want to feel low, so you go to antidepressants. No. Antidepressants only work when taken every day under prescription. And something to note is when you're taking antidepressants, the first week is the hardest, honestly speaking. The first week, the patient or the client will always complain it's hardest because you will experience mild side effects and they feel like the medicine is not working. If you're having maybe sleep pattern problem, this patient in the first 2-3 weeks, they'll be like, it's not even working, why don't we increase it? Some will be like, why don't we increase it, because it's not working, or let's just stop, the medication is not helping me, but it works. So the first time it's the hardest because of the side effects it comes with. Another thing with antidepressants, once you start feeling okay, that is, maybe you used to have lack of sleep and now that time you feel like, my sleep is back. So, and this doctor said maybe you take it for 28 days. Now you feel like, I'm feeling much better. So why should I continue? Why should I not stop? So it is not proper to just stop when you feel better. Another thing, when you are on antidepressants, it is advisable and very important you don't use alcohol or other common drugs. You don't abuse any alcohol, no use of any of those drugs when you are under antidepressants medication. And then ensure you have been prescribed the antidepressants from a medical doctor. Ensure they have been prescribed by a professional. That is, these drugs, sometimes people abuse them and they will really, really have a very huge effect on you. The side effects that you will experience at the first time usually go away when the medication starts to work. Now the side effects will now start to wear off, and you'll start to feel better in 3 to 4 weeks time. So it's nothing to worry, it's nothing to cause alarm. You just have to follow the instructions that the doctor has given you. Ensure you work on yourself also. So how do you manage depression? We are now on management. How am I going to manage depression? Number one, exercise. Exercise is very important. Go for a walk, go for a jog. If you're a person with the gym, well and good. Go to the gym, help yourself, exercise your body very well. Number two, you can go and play football. Do some playground thing. Outdoor games. It's good to engage in outdoor games. Even indoor pool, have table tennis. Just try and exercise your body. Number two is make time for those activities that you used to enjoy, like swimming, listening to music, watching videos, movies. Do things that you used to enjoy. Go for adventure, road trip. Go for a nature walk, just go and do things that you enjoy. If your hobby is traveling, well and good, take a vacation, go and travel. Number three way to manage depression is spend time with people who can support you. Spend time with people who can support you, people who really care about you, people who love you. Spend time with family, friends, people who are going through depression. Please hug them, give them a hug. It's not a sin. It doesn't cost you just to give someone a hug. It shows that you care about them, you love them. Sometimes, sometimes all you need is a hug from that right person. It doesn't have to be your boyfriend or your husband or your wife or your girlfriend, but even a friend. Just hug someone, reassure them you care about them. Reassure them that you are there for them. You assure them that they can count on your support. It goes a long way. Words of affirmation really, really work magic with someone who's undergoing depression. Put a smile on their face. Talk to them. Give them a shot. It doesn't cost to just talk to someone. Make time, just create time, talk to them, spend time with them, eat with them, reassure them that you are there for them, and do it by action, not just words, but give them that reassurance. Another one is practice relaxation activities, yoga, meditation. Take a bath. Taking a bath when you feel so worked up, it's a way of relaxing your day. So take that activity. Do meditation, yoga. You can do them. It should help you relax yourself. Another one is eat balanced diet. Avoid alcohol and smoking. Cut down on junk food. Include a lot of fruits and vegetables. It's going to help your body. It's going to help your immune system. It's going to boost your strength when your immune system is also boosted. The last one is set realistic and manageable and achievable goals. Don't go too high on yourself. You know your capabilities. It is important to limit yourself with your capabilities. Yes, it's good to think big. It's good to have high dreams, but also check your capabilities. Don't give yourself a span of 30 days to raise 1 million when your income is 10,000. You're going to kill yourself over nothing. Set managerial and reasonable goals that you can achieve. Another thing, acknowledge your accomplishments. Don't wait for people to clap at you. Oh, maybe what you're doing is good. No, you can do it for yourself. Tell yourself every morning, I am a blessing. What you speak, the power of the mind. This is something I was taught by my spiritual mother. The power of the mind is very, very important. What you think manifests. Your brain receives the information that you think, it stores it, and then with time, it will manifest yourself. If you keep on saying that you are a failure, your mind receives it. and then it stores it, and then with time you start manifesting yourself like a failure. So the power of the mind is very, very important. Acknowledge your accomplishments. Waking up, doing good things. When you've done it well, tell yourself, we did it. We did it. Congratulations to us. It's not a matter of people have to notice you. We have small achievements that you yourself, it's been a journey, accomplishments that you have really, really gained. It is important you do that for yourself. Reassure yourself that yes, today we didn't manage, but tomorrow is still another day and we are going to make it. It's a way of dealing with also your mental health, improving your mental health. Believe in yourself that you can do it. Believe in yourself that I can. And then when you do it, thumbs up to yourself. Tell yourself, congratulations. Please don't wait for someone to come and tell you you're looking good. Tell yourself when you look at yourself in the mirror, I am beautiful, I am handsome, I am looking good. Today, my clothes, my dress, I'm putting on a very nice outfit. I'm smelling nice, reassure yourself, love yourself, be kind to yourself. The next one, don't try to solve the big problems all at once. You will break down. When something is too big, partition it. Today I'm going to handle this. Then tomorrow I'm going to handle this. Then the next day, this is what I'm going to do. It will help you know where to start, how to deal, and it also give you time. So partition that big problem that you have, that you can deal with it in portions, that you can make it easier for yourself. You can make it easier for even your being, even your brain. That was it for today. I hope you learned something from today's video. Please remember to share, comment, and subscribe. Share out to as many as possible. Let me reach out to any other person that is not on this platform. That was it for today. Have a good evening. Bye. Till the next time. See you.